Hello, I'm Corinne Pellini from Ohio University. Thank you to those in charge of OOS for giving me the opportunity to share my research. Why does research about opioids matter? Well, I think it's safe to say that most people are aware of the opioid epidemic that has been going on in the U.S., originating in our very own Southeast Ohio. Physicians have the very complicated task of managing pain using prescription opioids, and it's further complicated by the need to consider social determinants of health. The Robert Wood Johnson Foundation suggests that of all factors impacting health outcomes, social determinants account for 80%. Therefore, this study used regression analysis to explore whether health determinants are associated with opioid prescribing rates and whether any associations found differ among Appalachian and non-Appalachian counties. We used the Robert Wood Johnson County Health Rankings as well as CDC figures for opioid prescribing rates. We merged these data and conducted linear regression to determine which variables might be associated with opioid prescribing rates. The regression modeling was used to explore how variance may be shared between the opioid prescribing rate and social determinants of health. For the first regression of U.S. counties, a statistically significant regression model was obtained in which 20 county health rankings helped predict the opioid prescribing rate for a given county. The coefficient of determination was roughly 45%, indicating that slightly less than half of the variance in county opioid prescribing rates can be accounted for by this linear combination of 20 predictor variables. For the second regression of non-Appalachian counties, 17 variables were found, and for the third regression of Appalachian counties, there was a stark contrast found. This model yielded only 7 predictor variables, which is considerably less than the 20 and 17 found previously. This shows us that opioid prescribing manifests differently in Appalachian compared to non-Appalachian counties. To further explore this finding, we recategorized the counties into 4 quartiles of rurality based on the proportion of residents in a given county living in rural areas. We conducted a 2x4 factorial analysis of variance to compare county-level opioid prescribing rates among Appalachian status and by quartile of rurality. We found statistically significant differences between Appalachian and non-Appalachian status, as well as between the lowest and second lowest quartiles and the lowest and highest quartiles. So in conclusion, we found that various determinants of health may be significantly associated with physicians' opioid prescribing rates, and that physicians' prescribing practices are not necessarily uniform throughout the country. Additionally, our results suggest that ecological factors impacting physician decision-making likely manifest differently in Appalachian counties compared to the rest of the U.S. Also, rurality appears to be associated with physicians' opioid prescribing rates and does not manifest in a linear fashion. Our model shows the ultimate importance of considering social determinants of health impacting a given county. We urge healthcare professionals to make note of the social determinants that affect their patient population and how this may influence health outcomes, such as the consequences of opioid treatment. Thank you.